on giving any treatment, but I used to take rounds. So that time we came across, I came across a lady nurse, a lady nurse who came to me with her problems. He didn't come to me with her problems initially. That is when she had typhoid. Of course, the whole hospital was dominated by allopathy, so she preferred the allopathic treatment. And when she came to me, hardly any hair had left on her head. That was the best part of her. She had a thick growth of hair till her waist, down below her waist till her hips. The thick growth of hair and double veiny. We call it double veiny. Is two uh, दो चोटी वो बांधती थी, and the hair were very thick. Though she was very thin and lean and thin and always with, physically she was very lean and thin, but the hair was the thickest in her body. So probably whoever must have married her, he must have fallen in love with her hair, probably. And so the hair, she had lost her hair, and they had become very small chotis on both the side, and she was quite anxious about it. She was didn't like it, and then when I took her history, the most prominent thing was typhoid is a prolonged illness. Typhoid is a prolonged illness because if you do in allopathic treatment, it needs at least 21 days of antibiotics to get rid of typhoid. Nothing wrong in it, of course, but then she was taking this allopathic treatment for a prolonged time, and then when she came to me, she had lost her hair, and hair loss after prolonged treatment or prolonged illness, the remedy is phosphorus. The second instance I'll tell you, after that, when Dr. Gaikwad and me we started working together, we came across a couple of patients who had undergone this post-cancer treatment. That post-cancer treatment means it might be radiation therapy or it might be chemotherapy. So whenever a person comes to you with hair loss after radiation therapy or chemotherapy, we we definitely think of is phosphorus, because hair loss after chemotherapy, radiation therapy, gastritis after chemotherapy, that's very important because they say भीख नको पण कुत्रावर, in Marathi we have say हमको आप हमको भीख मत दो मगर कुत्ता बांध के रखो. So similarly in chemotherapy there's the amount of retching and vomiting, it is severe, and the person says that, well, I'll rather not have chemotherapy, I'll rather prefer dying of cancer than having chemotherapy. So for this agonizing this agonizing condition after chemotherapy, again the remedy will be phosphorus, where you remember that phosphorus is having a lot of burning better by cold drinks and cold food, whereas in arsenic you have burning better by warm drinks and warm food. So here exactly opposite of arsenic, phosphorus is, and here because of the chemotherapy, you know, if there is intense burning, it can be reduced with the help of phosphorus, and we have seen very good results with phosphorus. Then, especially as we have talked about the hair now, then this is also in phosphorus. Apart from hair loss, there can be graying of early graying of hair. As I told you, graying is nothing but a degenerative change. It is a degenerative change. If a person is lean and thin and great desire for cold food and cold drinks, I don't think we should miss it, the diagnosis of phosphorus, and we can be sure that the young girl who has turned grey earlier can be restored with dark hair. So that is also one part of phosphorus which you can think of. Then one friend of mine who was basically he was blind by 1 year, that is the left ear. He was born with blindness, and right ear he could right eye was not left eye. He was blind by one eye. He hardly could see anything. It was only dark, and the left eye it was totally blind, and right eye he could read but he had to hold the paper very close to him and read, so with the right eye. So both the visions were weak, and he was born with that. So I was trying to find if phosphorus does work, and I gave him phosphorus 30 just for the sake of it. Nothing, no diagnosis here. It was only trial. I just wanted to see degenerative change. If it is a degenerative change of the optic nerve, then let's see if it works. And after 8 days, he came to me. He said that, well, I can see some, I can see some flashes in front of my left eye. So the left eye, which was dead, it was almost dead. I mean, there was no vision. It was only darkness. He started seeing flashes after 8 days. Then after 15 days, he said that he could distinguish between day and night. He could distinguish between day and night. After 21 days, 20, after 21 days, he said that, well, he could distinguish between a two-wheeler and a four-wheeler. He could make out this is a two-wheeler, this is a four-wheeler. And then further, there was no development, of course. Though I tried well till phosphorus 200, phosphorus 1M, I couldn't get any development. Probably the degenerative changes must have been permanent. But this vision, which was totally dark since his birth of the left eye, he could distinguish between a two-wheeler and a four-wheeler. And that was quite an achievement for me. But one more complaint, this gentleman complained that his wife is saying, how come you have become so young now? Because every day you need me near you. So every day you are trying to pull me near you. At the age of 45, what has happened to you? So now here again, phosphorus did work on some different region. That is because of the age-related factors, where a person does become less, demanding for sex. Here suddenly it had given him a lot of energy, sexual energy, and he started frequenting his wife. Where he started going to his wife quite frequently. So this is also a part and parcel of phosphorus. Remember, phosphorus is chronic of allium cepa. Phosphorus is chronic of allium cepa, and phosphorus there is a they say this onion that is allium cepa. Onion has got a lot of vitality, or it is aphrodisiac. Aphrodisiac means it gives, it is like a sexual tonic. Onion a day, well, you'll feel quite sexually active. So here, this because as I told you, it's like an aphrodisiac, and there is a lot of phosphorus in onions, and phosphorus is chronic of allium cepa. So when we come down to the nose, you'll realize that in nose we have loss of smell, a part of loss of smell because of chronic rhinitis, or whenever a person feels relieved with L-MSEPA, but it is not curable, then it can be followed with phosphorus, where phosphorus will give you the final touches of cure. So it is a chronic of L-MSEPA, that's why it will give you, as far as L-MSEPA is only relieving him, but not curing him, and every once in a while, if a person does suffer from cold, we think of phosphorus uh, for a curative method. Of course, you want to earn money, you keep on giving alum cepa, and the patient will come to you year after year as far as you don't want to cure him. Well, this is a part and parcel of course, the practice, what they do. But here, what I'm telling you is, this is where we have an upper hand wherever there is acute remedies and the chronic remedies. The phosphorus is one of the chronic remedies. Then in years, see, remember one thing, my dear friends, years, every sound has got a different frequency. Every sound has got a different frequency. As far as human voice is concerned, our voice is in a particular frequency. Dog's voice is in a different frequency. There is something called dog whistle. I don't know if you have come across that. But this whistle, when you hear, it is a very shrill voice. Something like that. We think that it's not very far, but the frequency of the dog whistle, a dog can listen to it almost if you have trained a dog in such a way. At least half a kilometer away, he can listen that his master is calling and he'll come immediately running. So this dog whistle is in a different frequency altogether. So in phosphorus, they say that phosphorus is having impaired hearing. They say it is having impaired hearing. Impaired hearing means what? I'll tell you a nice story where it was a joke which was told by Moin Akhtar. Moin Akhtar is a Pakistani commentator, and then but the way he narrates the joke, we have all heard the jokes couple of times, but whenever Moin Akhtar narrates the joke, you'll find them you like listening to them again and again because his way of narration is superb. तो इसे एक दोस्त अपने दोस्त के पास गया कहने लगा, अरे भैया मुझे 50,000 रुपए की जरूरत है, महीने बाद लौटा दूंगा. तो उसने इसमें क्या बड़ी बात है, ले ले. तो 50,000 रुपए के लेकर और कराची से लाहौर चले गया. तो जिसने 50,000 रुपए दिए थे उसने कराची से लाहौर ट्रंक कॉल बुक कराई. हेलो यूसुफ. हाँ यार यूसुफ बोल रहा हूँ. अरे काम कैसे चला है? बस काम ही तो ठीक चला है. अरे मैंने जो तुमको 50,000 रुपए दिए थे, अरे अरे हेलो आवाज कुछ ठीक नहीं आ रही, जरा जोर से बोल. हेलो मैंने जो आपको 50,000 रुपए दिए थे. हेलो आवाज कुछ क्लियर नहीं, जरा जोर से बोल. हेलो मैंने जो आपको 50,000 रुपए दिए थे. अरे भैया बहुत डिस्टर्बेंस है, जरा जोर से बोल. तो ये चिल्लाने शुरू कर दिया था ये कराची वाले ने. तो बीच में जो ऑपरेटर था वो सब सुन रहा था. तो उसने वो लाहौर वाले से पूछा, भैया आवाज तो ठीक से आ रही है. तो लाहौर वाले ने बोला, आ रही है. हाँ तो तू ही दे दे. तो बोलने का मतलब क्या है? There is an impaired hearing for human voice. If a person says that I can hear the mobile ring, I can hear the doorbell, I can hear the dog bark, I can hear the cat, I can hear the birds, but I cannot hear what you are saying. That is deafness for the human voice, or you've got impaired hearing for the human voice. So in that particular frequency, the phosphorus patient may not be able to hear. Then we go down further, that is the teeth. The teeth become, teeth are supposed to be the strongest material we can have in our body. But in phosphorus patient, you'll always find them loose teeth with, they move and they fall out easily. There's a loosening of the teeth, the gums become soft and the teeth become loose. Now this is again a typical early degenerative change. Now this happens at the age of 80. You can understand, of course, because he has crossed a particular age. But if it is becoming at the age of 30, then it's a matter of concern, grave concern, and we think of course, is phosphorus, where there is looseness of the teeth. Then he cannot strain his voice. Again, as at the young age, आप सब जानते हैं आपने कितना चिल्लाया है, आपने कितना दंगा मस्ती किया है. But here in phosphorus, you will find slight exertion of the voice and he goes into loss of voice or hoarseness of the voice, and he hardly can speak. So that's why there's a lot of similarity between phosphorus and causticum. Causticum also is worse by straining the voice. Phosphorus is also worse by straining the voice, but phosphorus can lose the voice because of straining, because the vocal cords are very, very weak. The cough also in phosphorus, the expectoration can be hemoptysis, there can be blood through the expectoration, but again, the cough is worse when he is moving around or when he is awake. Remember, the most important feature of the phosphorus is again its modality, better during sleep. All symptoms are better during sleep. As well as lachesis slips into aggravation, phosphorus slips into amelioration. Lachesis slips into aggravation. Lachesis says that I get aggravated, especially whenever I sleep, but phosphorus sleeps into amelioration. So all symptoms of phosphorus are better during sleep, and this is a very important symptom of phosphorus, where you will find he feels better He feels better during sleep. So even the cough is better during sleep. The fever is better during sleep. Fever is always low grade with lot of chills, with slight tendency, slight change of uh, atmosphere, because I told you he is highly sensitive to atmospheric pressures. That's why known as human barometer. And slight change in the temperature, and he can have uh, a fever, and that is always low grade. It is not a high grade fever, comes like a storm and goes like a storm. No, it is there. It is there for a couple of days. It's a chronic problem. Every evening you will have a rise of temperature. Every evening you have a chill, and then every evening he feels exhausted after fever. Then again the whole day he is not in his own self. So this goes on for continuous for a long time. Then we come to the stomach, where we have a great desire for spicy food, high seasoned food, zanzani tikat, what we call it, mirchi thesa, and all these things, khada, thesa. So all these things where Kolhapuri tamda rasa, misal, the misal of Kolhapur, that with the cut and misal, cut vada pav, and all this, which is very high season. It is a high season food, and plus there's a great desire for cold food and cold drinks. Now, one more thing I would like to bring to attention is the diarrhea of phosphorus, where diarrhea and the constipation both are very important here. The diarrhea, I don't know if you've been to Mumbai, the old Mumbai, that is the port area, where during around the Sachivalaya. So if you see, there are buildings. The old buildings are never above five floors. Now the new buildings, of course, they go up to 100 floors. That's not a problem. But in the olden days, the 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 buildings which were maximum 5 floors, because they didn't have a proper equipment, fire extinguishing equipment beyond 4 floors or third floor. So what they used to do, the pumps were not very powerful. The cars, the fire brigades didn't have big ladders to go to the fifth floor. So what they used to do is every house used to have a overhead tank. This overhead tank was connected by a pipe right in front of the building. There used to be a red thing. A red thing. We call it hydrant. We call it hydrant. Every old building there is a red thing in front of the building. So whenever there used to be a fire in the building, the fire brigade people used to attach a hose there, and they used to open the hydrant. So the overhead tank used to supply water to the hydrant, and at least to the fourth floor, the water could be sprayed, and at least if 4 floors could be saved. So that was the idea of hydrant. If you see in English movies, you'll find that there's a car chase, and suddenly a car hits a hydrant, and there's a spurt of water which goes up very high. Phosphorus is having diarrhea as if from a hydrant. Now remember, diarrhea coming out, it's gushing diarrhea, as if from a hydrant. It is coming out like a gushing diarrhea, as if coming out of hydrant. And constipation, they say that it's a dog-like stools or river-like stools. I call them like phosphorus personality, lean thin emaciated stools. These are dog-like stools, river-like stools, and he has to strain. You've seen a dog passing his stools. Sometimes you'll find a dog shaking while passing the stools, and it's a long stool. It is a long stool. It doesn't bring in naughty stools or in pieces, but it is a long stool, and this person has to strain a lot during constipation. Now, in when we talk about the menses of phosphorus, they say it is lean in emaciated lady, of course, but she faints during menses. She faints during menses. Now, why does she faint during menses? Because she goes into low blood pressure. Because of the profuse menses, I am again repeating it, it is a hemorrhagic diathesis, and because of the profuse menses, she can faint during menses. That means she goes into low BP. The blood, her body cannot sustain even the flow of the profuse flow of the menstruation, and uh, she can go into fainting spell. She can faint during menses, or she gets it is exhausting menses. She gets totally exhausted after menses, and she says that she has no power to sustain that. In phosphorus, couple of patients I have tried phosphorus. Whenever they say that, well, they desire for cold food and cold drinks, but still they don't put on weight. So phosphorus is an excellent remedy whenever you want a lean and thin person to make him healthy or on the not as fat as me, of course, but you want to make him healthy, well built. Phosphorus may be the choice of remedy as far as other symptoms correspond to it. So then one more thing about phosphorus skin, as I told you last time, the phosphorus skin is a very delicate skin. Why? Because the old cicatrix reopen. That means the old wounds they reopen. So when does it happen? Whenever skin is the skin is delicate and the scar tissue cannot take the pressure inside and it can reopen. Then of course last time someone asked me a question, sir, if there is an osteoporosis or osteomyelitis, can we think of phosphorus? I said, why not? Because it is having a degenerative changes. If the person remains, if the bones remain fragile, and if he has got a desire for cold food, cold drinks, and is highly sensitive to the atmospheric changes and lean, thin, emaciated, why not think of phosphorus, of course. So, my dear friends, I am putting you on the recording. I am putting you on the question answer spell, and if you hear me, you can ask me some questions if you like.
Sir, in the rhinitis, after Allium-cepa, when we have to give phosphorus, what potency we should think of?
See, normally if there's a chronic problem, ma'am, I always think of 30, unless he's a very young person. Unless he's a very young person, but I always start with 30 because I have a choice of increasing the potency. That is the most important aspect for choosing 30. Whenever you choose a lower potency, you always have a choice to go up. So if you start from the high ladder, how can you come down?
Okay, so single dose and we have to wait and watch?
No. I am a Calcutta school homeopath. I do give multiple doses. I was at least twice a day I'll give. That is, I'm this one Calcutta based homeopath.
Okay, sir. Thank you, sir.
Okay, good. Fine. Anything else?
Sir, what about mind?
What about mind? So I told you phosphorus is highly sensitive. He is a very good mimic. He is an excellent mimic. Who can be a good mimic? Only people who are sensitive. The people who are not sensitive, how can they be a good mimic? If you don't observe what's happening around, if you can't perceive things, so they are highly sensitive. And phosphorus likes to be magnetized. Likes to be magnetized बोले तो वो किसी को भी चिपक के बैठेगा या सोते वक्त किसी को चिपक के सो जाएगा. Or sometimes you will find he'll sleeping with one leg on his friend's body. जब उसको पकड़ के सो जाएगा. Or even when he walks, when he talks, he always try to hold on to something. He likes to be magnetized. Human magnetism. Anything else? Shall we end the lecture?
Yeah, sir.
Huh? Okay.
Yeah.
Thank you.
Thank you, sir.